PHSA Plus Awards program was created to recognize and celebrate the passion, dedication, and invaluable contributions our staff make every day to PHSA's vision, province-wide solutions, better health. This year, we made some changes to strengthen the award program by expanding the number of awards being given out. We had the opportunity to formally announce the winners at our last Leaders Forum and have been profiling each winner on Pod. We've put together a short video montage of all the winners. Let's take a look.
My name is Gail Murray. I work at Forensic Psychiatric Hospital in Forensic. I think the best part of the job is when our team goes up and delivers the food and the patients are waiting and looking forward to the meals and they have smiles, and a lot of them have come off the streets, so this is probably the best meal they've had for a number of weeks or months. And so when our staff go up and give them the food, they come back with all the positive stories, how happy the patients are, and I definitely believe it sort of promotes wellness.
I'm Gail Murray. I'm a radiation therapist from the Cancer Centre here in BC, and I work in Kelowna. We designed a tool called the LINAC Collision Tool Detection System that allows us to detect collisions between patients and the treatment machine prior to them actually starting their treatment. This saves time for our patients, for our physicians, for our treatment units, and for our physics and planning department as well. I think as a radiation therapist, we've seen so many changes over the years, and every day we learn something new, and that's what I love. I love the challenge, and I love learning, and I love doing the best that we can for our patients every day.
My name's Andrew Tugwell, and I was the Director of Population and Public Health when I was nominated for this award. In my job, I am in charge of a small team of excellent people who we really work on health promotion and prevention. So we really look at sort of upstream health. I just lead a team of really great people that do really important work.
My name's Rosalyn Livingstone. I'm an occupational therapist at Sunnyhill Health Centre for Children. I work on the positioning and mobility team and assistive technology teams, and I work with young kids who have severe and complex physical disabilities. The kids and the families that I work with really inspire me to come to work every day and to give 110% effort for them.
We're here because we won the award for the accreditation, the CCP education program, which really was a 2-year effort by a large group of people, including many more than you see here, which focused on a collaboration between provincial programs and BC EHS learning, which culminated in the award and accreditation of our CCP education program with the Canadian Medical Association.
We've also been fortunate to receive the award for the CCP Maintenance of Competency Profile, which again is a multidisciplinary team that contributed to that success. We're quite proud of that program because our primary deliverable obviously is patient care. And so we worked to identify strengths and areas that we could capitalize upon and validate our education program to ensure that our paramedics meet a certain standard for ongoing education to make sure that when they're in the field providing that patient care, they're the best that they can be.
I'm Dr. Danuta Skowronski. This is Catherine Chambers, and we belong to the Influenza and Emerging Respiratory Pathogens team at the BC Centre for Disease Control. Well, we work on really exciting things. We are the Emerging Pathogens department, and so scary new viruses like SARS or avian influenza, pandemic influenza, we mobilize quickly to identify the threat and to respond to it. I think it's great recognition of a really hard-working, passionate team. We really love the work that we do. Our definition of work-life balance is to really love your work, and we do. And it's so exciting working on emerging pathogens, and also, to know the work that we're doing is recognized and valued. We know that it influences the health of British Columbians, and not only British Columbians, but Canadians, and also it has global impact. So, but at home, it makes a big difference to know that it's valued. So it's wonderful.
Jana Kaiser, and I'm a clinical nurse coordinator at BC Children's Hospital.
So my name is Lisa Lupian. I'm a clinical nurse coordinator in the operating room at BC Children's Hospital. We're mission control.
We make sure things run smoothly.
I'm Sylvie Lengua. I'm a clinical geneticist at BC Women's Hospital, and I'm the medical director of the prenatal genetic screening program that's part of BC Perinatal Health Services. I got this award for the work I do for the BC Prenatal Genetic Screening Program. So there I'm the medical director that advises and develops and implements with the help of a team prenatal genetic screening for all pregnant women in BC who choose to have screening. What gets me excited about that job is it's an area that's constantly changing, and so it's trying to bring evidence from research into clinical care and really trying to get all women in BC to have access to such testing if they want.
My name is Jingma. I work at BC Women's Hospital. I am clinical resource nurse. My job is to provide clinical support for nurses anytime when they have questions, when they don't know the procedures, first time to go through the procedures, I'm there for them. And so this way, we're going to ensure quality patients' care. I love this job. I come to share the birthing experiences with the families, with the women, and I love to come every single day.
I'm Dr. William Dick, Vice President of Medical Programs at BC Emergency Health Services.
I'm Rod Salem, the Director of the Emergency Management Special Operations, BC EHS.
So we brought together a multidisciplinary team within our organization that liaised with other stakeholders throughout the province, the health authorities, Ministry of Health, and the Office of the Public Health Officers throughout BC to coordinate our response to the Ebola threat out of West Africa last year in order to coordinate how we collect and move and treat patients throughout BC who were at risk for Ebola exposure.
My name is Koichi Matsui. I'm a senior analyst with the PHSA IMIT Telehealth Department, just recently retired. We used to support a number of software products, one of which is a new project, which is the telehealth-enabled early hearing program, and we were actually developing the system from scratch with a small team. One of the things that really excites me is the use of technology, and especially when it gets out of the way, because sometimes it's very cumbersome to use. And so when we get new software or new methods to use the software, which allows users to basically do their jobs, I think that's really exciting.
I'm Dr. Wendy Norman. I work with the Women's Health Research Institute, and I have a chair in family planning public health research. Our work is helping people to access the contraception and the family planning methods they may need. And this, of course, gives society the best value, it gives communities the best value, it gives patients the best value. It puts patients first, or in actual fact, women in our province first. And that's part, of course, of BC Women's aim is that we provide health for all women in the province. And certainly that's the sort of work that I think is so important to do.
Satnam Sekon, Clinical Coordinator for Oncology and Nutrition at the BC Cancer Agency, Vancouver Centre. I work in clinical nutrition with patients who are undergoing treatment, trying to help them stay as well nourished as possible through treatment and improve quality of life around eating. I love the people that I work with, and I think I go home every day where I've learned something from the patients. I think the value of open to possibilities. I like to think of different ways of doing our work. We're very blessed in our department that our supervisor lets us be creative in the way we do our work, and so we've been able to implement a number of strategies to meet the nutritional needs of our patients, whether it's through website, patient education materials.
Hi, I'm Nick Smith, and I'm a project coordinator with the health promotion team within PHSA Workplace Health.
And I'm Allison Jones, Director of Workplace Health, which is a part of Human Resources. The Workplace Health team provides resources and programs that support our PHSA staff in being mentally and physically well and safe in the workplace.
Within the health promotion team, we're really focused on the mental and physical health of staff. So on the mental health side of things, we provide training and education to allow staff to recognize and respond to the signs of mental illness, both within themselves and within their coworkers. For physical health, we are focused on reducing the barriers to physical activity through discounts on gym and rec centers and providing on-site fitness opportunities.
Knowing that we get to contribute to PHSA staff delivering great patient care.
And just the opportunity to work with staff pretty closely, especially with our wellness teams and our health promotion initiatives fund, is just getting to kind of support them as they implement healthy workplace initiatives and getting to see those kind of go from idea to reality.
Do you know someone who is a workplace hero? Someone who shows care, innovation, or excellence in the work that they do? We're pleased to announce that we will be launching the 4th annual PHSA Plus Awards in January to coincide with our official Recognition Month, which helps us to set the scene for a culture of recognition for the coming year. The nomination process is simple and easy. Feel free to be creative. Submit short videos, poems, or pictures. The submission process will be open for 6 weeks, so stay tuned to PHSA News in January for more details. Do you have any feedback for us on the PHSA Plus Awards? We'd love to hear from you. Please email us at phsaplusawards@phsa.ca.